Welcome to Scrubcast, where we take a closer look at the research happening at Stanford University's Department of Surgery. I'm your host, Rachel Baker. Today we're speaking with Dr. Crystal Chang. Welcome to the show.
Thanks.
Thank you for joining us. Dr. Chang, you are a clinical assistant professor in our division of plastic and reconstructive surgery, specifically our dentistry section. Did you always know you wanted to be a dentist?
I did not. I knew I wanted to be in healthcare, but careers in healthcare can be just so different. I was really fortunate. I had a family dentist that knew me since I was in third grade, probably all through college. And at one of my appointments, I was talking to him about what the heck I was going to do after college. And he just suggested kind of coming in and shadowing him in clinic. Dr. Asarkov, shout out, he's the best. So I did that. He was kind, he was really patient with all my questions, and he was a really good mentor. So I think probably by the third or fourth day, I was pretty invested already, but really what happened, and we joke about it sometimes, is he was doing a procedure, removing a broken crown, and actual sparks flew, and he told me that my eyes kind of just jumped out of my face, and I was like, oh. But yeah, I mean, that moment kind of solidified it, to go from coming in with a broken crown with pain all the way up your face, and then to leave an hour later with a brand new tooth, no pain, all just because this guy could do what he could do. I loved it. So that's what I like about dentistry. It's an art, it's a science. There's an issue, there's options for fixing the issue, and I can do it for you all in kind of real time.
That's awesome. But private practice, I feel, is a little different than being a hospital dentist. And I have to admit that I didn't actually know what you did at Stanford up until about a couple weeks ago when I saw a few of your collab cases with otolaryngology. And I was like, oh my God, this is so cool. So can you explain what it means to be a hospital dentist?
Sure. Rachel, I didn't know what a hospital dentist was till probably the last year of dental school, and I bet a lot of folks don't know, so there's that. So I'd say technically being a hospital dentist is not really that special. It's just somebody who gives dental care in a hospital setting. Usually means specialized services. You're treating medically complex patients who just can't be treated, like you said, at a private practice office. Could be people with just extreme anxiety, developmental disabilities, maybe behavioral or mobility challenges. And then the medical complexities could be things like cancer, heart conditions, or even autoimmune diseases. I think that's probably maybe the textbook definition, but I think to be competent or even a successful hospital dentist, you have to be able to kind of juggle both the medical and dental worlds. Let me back up by saying, obviously medical school is medical school and dental school is dental school, separate. There are very few dental schools in the country that actually combine the first 2 years of academic study. And so you take classes with med students. I think that's probably the better way to do it. I mean, the mouth is connected to your body. And so it's kind of confusing to me sometimes why it's not its own specialty. But there's just too much ground to cover, really, for dentistry. Not only are you taking these kind of basic science courses, biomaterial courses, but you're also trying to master all these hand skills. Teeth can be really complex. I mean, every tooth is different. Every morphology is different. So I guess going back to your original question, in dental school, you kind of miss out on all that interprofessional communication and commonality. And so I think to be a hospital dentist is to be someone who's comfortable in that environment, or at least has had some kind of training in that environment. And hopefully that also means gaining familiarity and navigating a healthcare system. And then that way you can navigate it for your patients and advocate for them.
Love that. Well, so you touched on this a little bit. My dad had his triple bypass back in 2002. And I remember that after he had this procedure, he had to take prophylactic antibiotics when he went in to have a crown or a cavity. And I was like, WTF. But then at the same time, I was looking at your bio and I was like, oh, you deal with cardiac patients. So what do teeth have to do with cardiac disease and prosthetic joints and organ transplants?
Sure. The mouth is a dirty place. There's, all sorts of bacteria. Some are good, some are bad. When you get bad bacteria that multiply, they create biofilms. They become basically new beasts. And if they overstay their welcome, you get cavities. You get periapical abscesses, bone infections, swelling of the face. You can get kind of the foundation holding all of your teeth gets infected, severe periodontitis, everything becomes loose. The kind of flip side of this, a lot of times patients tell me, it's like, nothing hurts, doc. And I'm like, that's great. I'm glad you're not in excruciating pain, but it's broken. Like, you didn't start out like that. So your teeth literally start to kind of break down, crack, and fester. You're also swallowing all of this all the time, all day long. So it's a direct communication to the rest of your body. So maybe not as pertinent if you're healthy and your body can kind of absorb that assault. But if you're someone with vessel blockage or aortic stenosis, or your heart's not pumping at the rate it's supposed to, the ejection fraction is really low, then this bacteria is lingering in your bloodstream and can create big problems. So infection, and then the subsequent failure of the prosthetics, the implants, or even the organ transplants are all really real possibilities. So that's why, we love to kind of go in and see these patients ideally before something major. And that way, a lot of it is actually just empowering the patients, being like, hey, this is an issue. This is why it's an issue. How can we help you fix this?
We're going to have to pause right now because I'm going to go brush my teeth.
Oh. I was like, okay.
I'm perfectly scared now.
Brushing teeth is fantastic. Very low maintenance way to keep things well maintained. But I mean, people might take this cynically, but you just need a dentist. You need someone who puts on their little microscopic loops, looks at your teeth, and like thoroughly cleans out all the nooks and crannies. You just can't do it by yourself.
Brushing my teeth, plus go see my awesome dentist.
Yeah.
Twice a year. Got it.
Yeah.
Okay. I will hopefully not die.
You will not.
My teeth are not going to kill me.
I will not allow it.
Thank you. Well, so dentistry is only one facet of your work at Stanford. You also serve on our department's wellness committee as our associate director. Why is wellness so important to you that you're like, sign me up for extra work, boss?
Yeah, I'm going to be maybe a little vulnerable here. I think I'm into the wellness because I'm selfish. A few years back, I just felt like I was everywhere, running around doing stuff, and then everywhere I was doing something was just not the right place. Like, I needed to be somewhere else doing something else that was also very important. I was a mixture of private practice and then part-time at the hospital. And so I was running around from op to op in a private practice, cutting on teeth. And cutting on teeth is very exacting. The tooth is like a centimeter wide, centimeter long. Everything I'm working on is that tiny little, that's my canvas. And then I would jump and maybe do an OR case that's like really late at night. And then I would drive home and then try to catch up on charts and notes. This was the juice. I drank it. I kind of believed in it. I was like, to be successful, I need to multitask and I need to just keep pushing. And it worked for me. So I was kind of like, this is it. But I just got to a point where it felt very isolating. And I just felt like something's got to change. Like, I'm going to have a meltdown. The American Dental Association published a paper actually a while back before the pandemic, and it found that male dentists have the highest suicide rate. Female dentists come in at fourth. And then I think the other top 5 or top 10 rates all included physicians, pharmacists, and nurses. It's all healthcare.
My brother-in-law, I told him I was interviewing you today, and he was like, oh, dentists have a really high suicide rate. And I'm like, okay, 1, why do you know that? 2, what? I was shocked.
It's just, I think it's really isolating. Like in a private practice, you're the doctor. You have a team around you. They're fantastic. I have worked with lovely folks, very motivated, very educated, but you're the doctor. Everything kind of comes down on you. And so being at the hospital kind of mitigates that, because then I get to talk to like my colleagues and interact with other disciplines. But at the same time, it was just too much. So I just felt myself feeling like, not that the walls were coming in, but that they could. And I didn't like that. And so I just think that, wellness should not be branded as being selfish. I think wellness is just allowing yourself to take care of yourself. We've got to take care of ourselves. It sounds silly, but we've got to. And then taking care of ourselves, that means we got to take care of our colleagues. It's the only way the system has any longevity. So truly lucky that when I did kind of say, hey, I need to do something else, sign me up for the extra work, it's more that it was like Stanford already has an incredible infrastructure for well-being and that I get to play a small part in it.
Was walking by the construction the other day on Stanford's campus, and I saw this sign and I thought of
Ooh.
you. It says, "Warning, if you don't schedule time for maintenance, your equipment will schedule it for you."
Yeah. I think that applies to so many things.
Right? I
A
was like,
coffee
oh,
machine, but also your body.
but your body, right? I was like, oh, this feels like it is not just about screwdrivers or whatever
Yeah.
they're talking about. I was just like, oh wow, that's
Random
deep.
wisdom. Yep.
Well, so May
Yeah.
is Mental Health Awareness Month. Can you tell us about some of the things your team is working on to improve the mental health of our faculty and our residents?
Sure. So, I mean, Cindy Kim is the director. She's amazing. We've, I think, done a pretty good job of hopefully acknowledging that our surgery colleagues just need time to take care of themselves. So, she's launched the Tell Us About It campaign, which is anonymous or not, QR code, voicemail, however you want, just to leave feedback and tell us how your day is going, tell us what's working, what's not working, tell us you want drinks in the lounge, tell us you don't. So tell us about it. I think it's just opening that up to say, like, hey, your well-being is not being selfish. It's important. Other things that we've kind of, similar line is just we've had events with speakers sharing about reproductive and fertility wellness, menopause, and hopefully in the upcoming months, we're working on kind of a new parenthood or parents information exchange, getting vision and dental resources to our surgery residents. We also did surgery peer support, which is something that we learned from our anesthesia colleagues. It's where if a surgeon has experienced an unexpected event and wants to talk to someone about it, we would automatically reach out to them and say, hey, if you'd like, we're here. We can pair you with someone inside or outside of your specialty that's a surgeon as well, just to talk about things. And if you don't want to talk to us, that's fine. But here are some kind of broader resources that Stanford has to offer. And I think just getting that implemented in a timely fashion is helpful.
Well, so one of the initiatives I want to dive into a little deeper is you mentioned Tell Us About It. And I think one of the first things that came in on that anonymous form was OR efficiency. And so you've made it one of our goals for the year, and we're working on it with our QI team. How do you even go about starting something as I don't
Yeah, that expansive, right?
yes.
Yeah. So, I mean, I think the first is just to find the common ground. Everyone here really cares about the patients. Everyone here wants to do a great job. And also, everyone here is really good at what they do. And I think if we find that commonality and then take a step back and say, these are very common things that are happening once or twice a week, can we hit these high yield issues and maybe make that change? OR inefficiency is so broad. The well-being committee or team decided to tackle communication. And again, this is just about making sure everyone in that room feels comfortable speaking up and saying something. And I also think it's about building empathy for each other and our roles. Like, we obviously all value each other, but at the same time, I don't think we all realize that moments of high pressure for me are very different than moments of high pressure for me being the nurse I'm working with, or the anesthesiologist, or the patient. And so working on that communication and kind of finding ways to improve it has been that focus. Still a work in progress.
Very exciting. Well, that sound means it's time for our lightning round.
Uh-oh.
On each episode of Scrubcast, we ask the same two questions.
Okay.
First one is, who is a surgeon you admire and why?
Huh.
You could say dentist instead if you wanted.
Okay. That one's kind of tough because I guess alluding to your previous question, we're a little bit fish out of the water, although I really believe we belong in the ecosystem. I had a professor in dental school. He's an oral maxillofacial surgeon. He gave us some of our didactic lectures, and he was in charge of the implant program. when I was there, and he was just a cool guy. He would give us lectures. He wasn't afraid to talk about cases that didn't go as well as he expected. In fact, I feel like he made it a point to be like, what do you guys think about this? Like, I think I should have tried something else here, or maybe this would have worked better. Let's do it the next time. So he was humble, and all of his lectures were kind of a mix of clinical cases and evidence-based literature. I would say he's the main reason I pursued a general practice residency and got hospital training. Yeah, he's the guy I would point to, Dr. Hussein.
Awesome.
Yeah.
Sounds really cool. Well, the second question is the best advice you have received in 10 words or fewer.
At this moment, I think the best advice is appreciate how far you've come and then keep going.
Ooh, oh, I like that. Do you put that into your daily practice at all?
Yeah, I do. I think it's sometimes when I'm in a high stress moment, I'm like, but you know what? I watered my plants. I brushed my teeth last night and I put my head on a pillow. We're good. And you just move forward.
I think we should all try and remember that going through our daily routines.
I know, it's tough sometimes.
Well, it's been an absolute pleasure chatting to you. But before we go, I want to ask you one final question, and that is, what is next for Dr. Chang?
Oh, next for Dr. Chang, well, I became full-time at Stanford, so I'm still kind of exploring all of the wonderful opportunities that entails. So I guess we'll see.
Awesome. All right. Well, thank you for coming on the show.
Thank you so much. I loved it. It was fun.
Great. And thank you to our listeners for tuning into this episode of Scrubcast. Until next time, stay sharp. If you like Scrubcast, we hope you'll tell your friends and subscribe wherever you get your podcasts. Scrubcast is a production of Stanford University's Department of Surgery. Today's episode was produced by Rachel Baker. The music is by Midnight Rounds, and our chair is Dr. Mary Hahn.